Good evening. You're all very welcome. I'm Professor Michael Keane, the Dean of Medicine, and it's a real pleasure to welcome our students and family here this evening. I'd also like to welcome His Excellency Zakaria Nasir, Ambassador of Malaysia, together with Ms. Siti Noralia Mustaza, First Secretary, and also Ron Bulger, the Honorary Consulate General of Singapore in Ireland. So this evening marks a milestone in the education of our students. It marks the transition from the preclinical training into the clinical training, and the donning of the white coat marks that transition, and it really is a great privilege for everybody to have the opportunity to interact and take care with patients, and with that great privilege comes great responsibility, which I know you're all well prepared for. So this evening we'll bring the students up in groups of 10, and the white coats will be put on by my colleagues here. And I'd ask that we don't applaud every student, every white coat. We will stop intermittently, and I'll ask you to applaud at that stage. So we'll go ahead and we'll start the evening. Okay, Dalia Abul Saad, Nabil Hussein Akhtar, Mihad Musa Al-Haini, Tariq Al-Karouzi, Sami Al-Mukazzim, Mariam Al-Razi, Zara Al-Rashti, Sana Al-Baraki, Sufana Al-Sif, Ragad Al-Shamasi. Okay, we can move on. Chanakaya Anand, Himanshu Anand, Patricia Antifoff, Samid Arshad, Megan Barry, Alvi Benson, Lucy Bergen, Emily Burnett, Michael Binchy, Eve Blake. Okay, thank you. Michael Boland, Grace Boyd, John Paul Breen, Dylan Brown, Laura Brune, Eleanor Buggy, Lauren Burke, Kevin Caldwell, Aisling Callahan, Asa Carley. Thank you. Paul Carroll, Sue Mi Liliane Che, Shannon Chen, Daniela Sino, Gavin Clark, Margaret Clerkin, Rosalind Colgan, Katie Connaty, Shane Conlon, and Chloe Conroy. Mark Considine, Megan Conway, Sophie Craig, Edward Cummins, Clodagh Curran, Tapiwa Dabutha, Robert Daly, Liam Dean, Thomas Dean, and Cormac Dempsey. Alana Dolan, Wyatt Doherty, Sofia Dragosevac, Evelyn Elias, Lee Enye, Shane Evans, Niamh Farrell, Molly Featherstone, Aideen Feely, Hannah Marissa Faisal. Liam Fitzsimons, Barry Fleming, Jack Flynn, Kate Flynn, Mary Forsyth, Sean Frison Roach, Nell Garvey, Sean Garvey, Niamh Geraghty, Anuj Gaj, Colin Gilligan, Amy Gilmartin, Aoife Gordon, Patrick Gorman, Michael Grudzian, Emma Haran, Daniel Hassett, Ellen May Hayes, Luke Hayhoe, Kieran Hennessy. Jack Henry, Abdul Razik Hider, Nikita Iliensky, Haley Jackson, Chris John, Miles Johnson, Laura Joyce, Eniola Kasim, Francesca Keane, Michael Keane. Frank Keating, Michael Keeley, Andrew Kelly, Stephanie Keogh, Charlie Kerr, Sharzad Kait, Malia Kistner, Carmelia Neefsey, Daniel Cohalan, Mojavanjeet Lail. Sean Landers, Matthew Larney, Nadira Leus, Dara Lennon, Finian Layden, Liam Lockery, Tita Lundell, Claire McBride, Lucy McCauley, Quifa Madden. Charlotte Madden, Kylie Maller, Barbara Minoli, Lynn Manahan, Larissa Manonjovic, Cleena Matthews, Laura McCarthy, Sarah McConnell, Cleena McCullough, Alexander McDade. Finbar McDermott Long, Alana MacDonald, Aisling McIntaggart, Emily McGarry, Fanula McGovern, Maeve McGrath, Sarah McKernan, Michael McMonigal, Conor McNamee, David Minahan. Farah Iziana Mior Feza, Tariq Masalati, Belinda Mitchell, Muhammad Irfan Muhammad Azwardi, Jana Muhammad, Colin Maloney, Emer Monaghan, John Moore, Lucia Moore, Fergal Moran. Edward Moran, Gregory Morrissey, John Moylett, Oitin Olivia Mui, Nariani Mukherjee, Aoife Mulva, Philip Mulvey, Shane Mulvihill, Conor Murphy, and Ailish Murphy. Leah Nash, Emily Needles, Fiona Newsom, Sarah Sue Yi, Sue Ni, Jeremiah Nolan, Amir Rusaidi Noor Azmi, Matthew Normeal, Ellen O'Byrne, Jonathan O'Brien. Maeve O'Halloran, Conor O'Hanlon, Christine O'Leary, Sarah O'Loughlin, Eva O'Riordan, Aoife O'Sullivan, Declan O'Sullivan, Georgia O'Sullivan, Emmanuel Oha, Ian Ryan Ong, Michael Oyuga, Zhao Shan Pan, Quiva Patchett, Colin Pilo, Sarah Pender, Oisin Pennycook, Alix Petit, Alethea Purnaselvan, Caroline Pryor, Caleb Key, Matthew Wen Young Kwek. Oh, sorry. Oh. Sorry. We'll start again. You get called twice. You'll call you twice. Matthew Wen Yang Kwek, Katrina Quinn, Maha Ramani, Sheila Roberts, Mihai Romanovsky, Elaine Rose, Noah Rowan, Aaron Ryan, KG Ryan, Sean Ryan. Jacqueline Safaya, Mariam Saleb, Ioya Salgado, Jack Scully, Aoife Samar, David Shanahan, Leanne Kayla Rebecca Miyi Shaw, Liam Shaw, Nilaxa Sivanetharan, Tuva Scar. Terence Smeaton, Emma Smith, Yubin Julie Song, Michelle Soy, Juliette Storen, Lee Wan Miratan, Marvis Shi Min Tan, Joseph Taylor, Alexandra Tierney, Leah Timon. Eno Tampuri, Aziz Yukpanu, Nivya Uni, Aveen van der Hoven, Emma Mary Walker, Anne Walsh, Donica Walsh, Sarah Walsh, Stephen Ward, John Williams, last but not least, Megan Wilson and Nicholas Zhang. I now call on our keynote speaker tonight, Professor Tygo Dwyer, who's Professor of Otolaryngology and Head and Neck Surgery.
Before I start, maybe we'll give a round of applause to the Dean for getting all the names right. On behalf of the School of Medicine, I'd like to welcome the class of 2022 and their families to the ceremony tonight. As Michael said, my name is Tygo Dwyer. I'm an ENT head and neck surgeon and I'm head of Department of Otolaryngology, ENT for those who don't know, at UCD. The white coat ceremony was first introduced in the US in 1993 in New York to welcome students to the medical profession and to inform them of their roles and responsibilities, essentially to foster humanism in medicine. And here it's a little different. It marks a watershed, as Michael has said, from medical pre-clinical scientific education, essentially, to clinical patient-based education. So I'd first like to welcome the students, all 225 of them, to this celebration. It takes place to celebrate your achievements to date, and it's used to outline what is expected of you in the clinical setting. As important, if not more important, I'd like to welcome your family and friends. Many travel long distances from over 50 countries, and a total of 500 to 600 people are here to support you. And finally, I'd like to welcome our senior medical staff, your educators who are sitting here behind me. They have been involved in your education to date and will be involved in your education in the future, the value system of the medical school. At this point in your education, you're 2 years from qualifying as a doctor. The next stage of your education is based on what some call the art of medicine, where the patient is center stage. I want to discuss what your responsibilities will be and what is required of you in this phase of your education. For centuries, there's been a debate as to whether medicine is a science or an art. Medicine has advanced with the progress of science, and boy, the progress of science has been phenomenal in the last century. Medicine is both a science and an art, and both are interdependent and inseparable. The importance of the art of medicine is because you have to deal with a human being, his or her mind and body. To be a good medical practitioner, one has to become a good artist with sufficient scientific knowledge. What exactly is the art of medicine? The art of medicine deals with the whole gambit of the doctor-patient relationship. You need to be able to listen. You need to be able to communicate. You have to develop a rapport to show sympathy, concern, and compassion. If that's not enough, you need to be able to assure the patient and show empathy. Diagnosing disease and choosing the best treatment requires scientific knowledge. Currently, we use evidence-based medicine to facilitate management of the patient's disease. However, many other qualities go into achieving a successful outcome. Finally, you need to be honest with the patient and their families. You need to gain their trust. You also need to recognize your own limitations and be accountable for your actions. So that's a lot for you to remember. If you dedicate yourself to the art of medicine, it's a lot of work, it's a lot of endeavor, but it's very rewarding to both the patient and the doctor when this is performed very well. On many occasions, doctors are criticized, not because of their paucity of knowledge, rather because of insensitive behavior and for completely ignoring the emotional distress affecting a sick individual. So remember, you're dealing with a vulnerable person and someone who requires your respect and attention. We are lucky here in Ireland that patients are very open to allowing you to examine them. I've worked in Ireland, the UK, North America, and it's not quite the same outside this country, but patients are very accommodating and helpful. Just 3 days ago, when I was on a ward round before going to theatre, we came across a patient with a large neck mass, and he, off his own bat, called the 4 students to come and examine his neck, as he felt this was important, and he had not been prompted by any of the senior medical staff. So rarely have I come across a patient who's refused to talk to or be examined by a medical student. So you should really take that on board, and this is a crucial part of your ongoing education. One quality I'd like to say a few words about is trust. In effective medicine, the power imbued in the doctor is based on trust. If patients have trust and confidence in their doctor, they will follow his or her advice. If trust is absent, they will not. Trust blossoms not only because of competency and skill of the doctor, but also involves sensitivity to another person's views. Over the last 30 years in clinical practice, I've noticed a change in this area. With more information readily available via the internet, social media platforms, patients are less inclined to trust their doctor. So you need to be aware of this. It's up to you to focus on patient care over the next 2 years and learn how to gain patients' trust. And once you have that trust, never abuse it. I have asked you to brush up on certain characteristics or behaviors which I know have been taught to you by your parents. Hence, they are there and just need to be brushed up on. In medical school, every specialty feels that what they offer to the student is vital to their education. Hence, the humanities sometimes get squeezed out or perhaps are a little forgotten. Your time is so valuable, and we want as much time with you as possible. From now on, and for the rest of your life, you will deal with patients. Remember to listen to them, be kind, and apply your scientific knowledge with a common sense approach, and your rewards will be great. Of all the professions you could have chosen, and I have no doubt you could have chosen anyone you wanted, medicine has the capacity to reward you most. You do not have to go looking for reward. It's there in front of you every day. And I don't refer to monetary reward. 10 years ago, almost to this day, I had a cardiac arrest while out running. Thankfully, I fell beside a John's ambulance paramedic and he successfully performed defibrillation. This helped me focus on what's important in life. When I trained in Toronto, I worked 7 days a week, as my boss did. When I came back to Ireland, I worked 7 days a week. You don't need to work that hard. You wouldn't be here unless you were good workers, and so that needs to continue, but perhaps not 7 days a week. You'll get lost in work, but try to have a good work-life balance. Find out what's important to you, and family and friends and loved ones are vital as well. Don't forget about that as you go through. To finish, I'll leave you with a quote from Albert Einstein. The most beautiful thing we can experience is the mysterious. It is the source of all true art and all science. He to whom his emotions are a stranger, who no longer pauses to wonder, is as good as dead. His eyes are closed. So I wish you all and your families a most enjoyable evening. You have done so well to get this far, and I can guarantee you progress from now on will be quite easy. Thank you to the parents and friends for supporting them. That's a guarantee I give you. And thank you for coming here tonight to show your support for the school and the educators. Goramagut.
Thank you very much, Tig. I'd like to echo what Tig has said, that as you enter this clinical part of your training, it can at times be stressful, and it is very important that you look after yourselves and you think about your well-being, but also equally as important as looking after yourself, you look after each other. You have made great friends and colleagues over the few years you've been in UCD, and I think those bonds and friendships will strengthen over the clinical years, and over the coming years after that. You will make friendships that last the rest of your life, but it is important to take care of yourselves, but also to take care of each other and look out for each other. I'd like to echo what Tig said. I'd like to thank all the families that have travelled some long distances, some from overseas. It's a real pleasure to have you here today, and to start to see the progress from the efforts you have put into your children. So thank you to all of you. I'd like to thank the administrative staff and the School of Medicine for their efforts in organising this together and making sure everything works seamlessly. And I'd like to thank all of my colleagues in the school, both those on the stage and those not here this evening, for the efforts and time they put into teaching and making sure you receive the best education that's available in medicine. So that's all the formalities for this evening. Before we process out, I would ask the students to stand and turn and face the photographer to get a group photograph. We'll ask the staff to stand too. Okay. That concludes this evening's events. We do hope that you'll join us outside in the conservatory for a small reception. Thank you all.